Well, good evening, everyone. We have a great crowd and we're really excited about our training tonight. We are going to be talking about home and community-based services. We had a training in September with Katherine Weston from Alta Regional Center. We did another training in October where we focused on how HCBS affects residential services. And we realized that we were missing out on a lot of family members who were busy during the day and couldn't come to our trainings, as well as self-advocates. And so we scheduled an evening time to be able to do the training again and really have it focused on how this affects families and individuals with developmental disabilities who receive services from the Regional Center. And so we're glad that you could join us. We have folks from all over the state, and we also have Spanish language translation going on simultaneously. So if you need that, there are instructions. Maybe we could post them one more time, Katherine, and select the Spanish channel in the globe at the bottom of the screen, and then you'll be able to hear the Spanish translation. Thank you to Stella for being our translator tonight. And Katherine and I will both try to speak slowly so that she can interpret what we are saying. All right, so my name is Sonia Bingaman, and I am the manager of the Sacramento office of the State Council on Developmental Disabilities. The Sacramento Regional Office covers Sacramento, Yolo, Yuba, Sutter, Colusa, Placer, Nevada, Alpine, Sierra, and El Dorado counties. State Council has 12 offices around the state, and we are just one of those offices. The State Council is a federally and state-funded agency. Our goal is to help families and individuals with developmental disabilities to understand their rights and access all of the services in the community to help them live the best life that they can live, access all the services that everyone wants to access, whether that has to do with living in a home, transportation, job training, community access, recreation, healthcare, education, and generic service, so accessing everything else in the community. So we are so glad to have you here, and a few more bits of housekeeping. So we will be using the chat for some of the questions that Katherine will be asking, and we'd love to have your input in the chat, or you're welcome to come off of mute and ask a question. You can raise your hand, but you know, we're all together here, so just feel free to go off mute and go ahead and ask your question. We will be stopping every few minutes for questions, but if something, you know, comes up right there and you want to ask a question, that's fine. Go ahead and ask your question. And then we also will be launching a few polls. If you're not familiar, that will come up in the middle of your screen. I will warn you when we're going to do that, and I will also read the poll and the poll options. You can select the options in the poll, and after a couple minutes, we will then share the results. So that is a poll. We'll probably have about 4 polls during the 2 hours together. And at the very last poll will be one asking about your satisfaction with the training. We always like to get your input. Toward the end of the training, please feel free to write comments in the chat and say what you thought about the training and how it could be better, what other trainings you would like, what other questions you have. So we really always welcome your input and feedback. So now we'd like to go ahead and turn it over to Katherine Weston. She is the HCBS Specialist with Alta Regional Center, and we're so glad that this is the 3rd time she's been willing to share with us. And actually, I just wanted to introduce one other person, Katherine, before I turn it over to you, and that is Lisa Cooley. Lisa will also be sharing a little bit about how HCBS affects her and her hopes for things that she's going to be doing in the next few years in her life. And so Lisa will be chiming in as well. Lisa, can you kind of wave there? Yeah, there you go. All right, so thank you, Lisa, for joining us, and I'll turn it over to you, Katherine. Thank you again.
All right, thank you so much, Sonia. Well, good evening, everybody. It's nice to be able to chat with you guys tonight. I appreciate you making the time. Hopefully this different time frame works well for you and your schedules. Just to introduce myself, I'm Katherine. I'm the Home and Community-Based Services Specialist at Alta Regional Center. It's kind of a mouthful for a title, but what it means is I'm really the resident expert on the final rule and how that's being implemented within our regional center. So what that means is I do a lot of trainings, I do a lot of consultations with our service providers, with families, the community, and with our agency staff as well. So real quick, I'd also like to introduce a couple other of my colleagues. Cindy Lay, she's our employment specialist at Alta, and she may be chiming in with some employment-related perspectives. And also Michelle Johnson, our associate director. And so she has a great wealth of expertise with case management. So I know you guys all are from different experiences as well. And if you've got questions that we can assist you with, we certainly would love to do that while we can. If you've got questions that are pretty general, it maybe applies to a whole type of service or maybe to a lot of people in a similar situation, that would be great to ask. If it's really specific and unique to a specific situation, I would encourage you to maybe start composing an email, and you can send me that and I can connect with you on a one-to-one basis. So I don't want anyone to feel like they weren't heard tonight. We're here for you to answer your questions and to give you some insight about the final rule, hopefully. So my background, I've been in this field since 1997. I started out working in adult day programs, and I came to the regional center system in about 2009. And I've been working in community services with our service providers, vendorization, for about the past 5 years. Most of my experience has been working with adults and the day program service specifically, but I've worked with children probably ages 9 and through adults up through age 65. So if we don't have an answer for you tonight, we will do our best to get you the answer that you need.
Katherine, let's just check in with Stella. Are we going too fast? It's okay? Okay, thank you.
Other things that I've been involved in at the regional center have been person-centered thinking training. I've been going through the certification process with Cindy as well, and we're hoping to at some point be able to bring that to the community to provide some trainings on person-centered thinking and person-centered planning. And I really want to hear from you guys to make sure that we're hearing what your questions are, what you're interested in learning about, and hopefully we'll give you kind of a flavor of what the final rule is all about and what changes might look like, what to expect from service providers, and how this impacts you, depending on what your role might be on the planning team. Alrighty, so one of the things I'm gonna ask of you guys, I know that at the regional center, we have a whole assortment of acronyms that we tend to use, a lot of letters we start throwing out, IPP, HCBS, CMS. So sometimes people will catch me, hold on, not everybody knows what you mean when you start throwing these letters around. If I start throwing something out inadvertently and I'm not defining or explaining it, I welcome any one of you to maybe put the, the full words in the chat box for other people to see. So go ahead and volunteer yourself. You know, you can do that while you're sitting at your computer. And so that will hopefully help us. I'll keep on the same page, but I'll do my best. All righty. So I think, let me pull up my presentation. I do have a PowerPoint prepared, and then Sonia's going to launch us a poll to start out. All right. How does that look?
Good.
Good. So I will give you guys a minute if you would like to take note of my email address. That's probably the best way to get a hold of me. And I'll put this up at the end as well, and maybe Cindy can add that into the chat box for folks. I do like to be accessible, and I'm here for you. Alrighty, so go ahead and launch our poll, Sonia, when you're ready. Our question is, how familiar are you with the CMS final rule requirements? If we were in a room all together, I'd be asking for a show of hands, right? So this is another way that we can check in and see where you're at. Maybe you've never really heard much about it or have a lot of confusion. That's okay, I'm glad you're here. Maybe you feel like, oh man, I've been going to a lot of trainings and I feel like I could be giving this training. Maybe we should partner up for the next one. All right, so we've got some questions or some responses coming in. I'll give you guys a minute to complete that.
Okay, I'm going to read the question for everyone. It's, how familiar are you with the CMS final rule requirement? First option is I know nothing about the final rule. Second option is I know a little bit about the final rule. And the third option is I know a lot about the final rule. And we already have quite a few people have answered. And Cindy, I typed Katherine's email wrong into the chat box. So if you could please retype it correctly. Okay, 40 of you have answered. So 30 of you have answered. We're gonna go ahead and end the polling and share the results.
Okay, so about 30% of you said, I know nothing about the final rule. 50% I know a little, and 20% I know a lot. So we're kind of all across the spectrum. So I really hope that each one of you has at least one takeaway. If you feel like there's a lot of information coming at you, you don't need to take everything and do it all today. Find one thing that you can put into practice and take away and take back to your planning team. And if you've maybe been around a little while, you've been to some trainings about this, you're welcome to share some of your experience of how maybe you've been working to implement it in your own setting. It'd be great to hear from you as well. And just so you know, a little heads up at the end of this, I would really appreciate if each of you would share one of your takeaways in the chat box. So at the end, we will stop and ask, take a moment to type that into the chat box so that we can all be in community together, right? We're on this journey, we're learning, we're growing. So that'll be something that you could be thinking about as we go through the presentation. Okay. Let's go ahead and get started. So does everyone still see the poll, Sonia? Are you able to take that down?
I thought I took it down.
It's right in the middle of my screen for some reason. And maybe it's just me, I don't know.
Okay. Is it gone now?
No.
It's not gone.
Oh, tell you what, let me.
Maybe you can exit out.
I did. Are you still seeing it?
I'm still seeing it.
Yes.
Okay. There we go. We're on the third slide now.
Are you still seeing the poll?
No.
No.
Okay. All right.
I am. Maybe it's just me.
Go ahead and exit out, Catherine. See if that works.
I lost my cursor.
Oh, you're a co-host, so.
So I don't even know if I can stop sharing my screen right now, but as long as we can move through the slides, I'm just going to go forward with my presentation. And if I look cross-eyed, then I'm looking at that poll from the very first slide. Okay, so what is the final rule all about? Where did this come from? So before we can answer that, we really need to look at why do we have a Medicaid waiver? Why do we have funding for Medicaid waiver? And this goes back to a little girl named Katie Beckett. Isn't she cute? She's such a sweet little girl in this picture. Katie, if you haven't heard her story, was a little girl who got very, very sick when she was about 4 months old. She was diagnosed with encephalitis and was in the hospital where she needed assistance to breathe. I'm sure her parents were very worried while she was in the hospital, and fortunately they got the good news that she had stabilized, was improving, and was ready to go home. She would still need some care, but it didn't need to be in a hospital setting. So that was the good news, right? She gets to come home. The bad news is at that time, funding for the care that she did need was tied to hospitalization. So even though care at home would have been less costly, it wouldn't be funded because of the way it was set up. So her mother was an advocate, and she went to President Reagan and made this pitch that, Medicaid is spending all this money for her hospitalization and her care there. She can come home where she's surrounded by family, she's comfortable, it's less costly, there's less that's involved. So it would really save the government money, and it's better for our family. And so Reagan was sold, and the Katie Beckett waiver was born out of that. And that has evolved to become the Medicaid waiver. If you have heard that term, a Medicaid waiver means it's a waiver of the requirement for institutionalization for funding. So the whole purpose is that the federal government is subsidizing with money community-based services, home and community-based services. So we call that in our little acronym, HCBS. That's our first one. You'll hear us talk about HCBS. That means we're getting money for services that are supporting people to be in their own homes, to be in their own communities, as opposed to an institution, a hospital, a developmental center. So that funding is overseen, directed through what we call CMS. That's our next acronym, the Centers for Medicare and Medicaid Services. That's the federal agency. So they're the ones that set the regulations. If we're going to provide money for these things, these are our expectations. You know, these are the rules that you have to follow. There's strings attached when there's money, unfortunately. And there was a change to what those expectations were that was adopted in 2014. So this is what we're referring to when we talk about the final rule. The final rule was that change to the requirements that was adopted in 2014. You might hear it being called the CMS final rule because it's the Center for Medicare and Medicaid regulation. You might hear the settings rule because it does apply to settings where services are provided and some of the expectations there. You might hear, yeah, HCBS, CMS, final rule. It's really all talking about the same thing. So this applies to pretty much all of the services that are funded through the regional center. You'll hear a lot of focus on congregate settings where services are provided, such as day programs, care homes, but really, if it's funded through the HCBS waiver, then it needs to adhere to what these requirements are. So we'll give you a sense of what that involves. So accountability, how do we make sure that this is happening? Who's making the changes? It really falls on the service providers, the vendors of the regional center for our system, even though this applies to even, you know, other systems outside of ours. The providers have to show that they're in compliance with these regulations. And because it could be a pretty big change if people need to change their program design, their location of services, their model of how they're providing services. This isn't something that people were expected to change overnight. They're given some time. Originally, they were given 5 years for all of the states, and this is across the nation, to show CMS how they were going to implement and assess and make sure everybody had updated services if they needed to. Over time, we see that this is a pretty big change for some of our systems. It's a lot to take on, and so we've had 2 extensions, and so now the most current deadline that's been given is March 17th, 2023. So basically, what this target is, if service providers are not in compliance with these requirements by March 17th of 2023, they can no longer be funded for their services, which means that participants might be relocated. That's really not what we want to see. We don't want people to lose any services. We always want to have more options, not fewer, right? So we're working with providers to know what the expectations are for them, and as well as for other members of the planning team too, to know what their part is. Because so far this sounds like this is all on the providers. They need to do what they need to do, right? But it's really a partnership, because the way that providers are going to be assessed, even though the accountability is on them, it's about the experience of the people that are receiving services there. So it's about people getting to do activities they want to do, spend time with people they want to spend time with to get the support that they need. And that can only be assessed on an individual basis, right? Are you getting the support you need to have full access to the community, right? And so for different people, that's going to look different in different settings. Alrighty. So you might see some changes. You might see a shift from more segregated services to more fully included in the community. You know, we've had a lot of day programs, for example, that are site-based. They have a building where services are provided. And if you look at Title 17 regulations, that just says community-based, means not in an institution. We really want to see that people are being supported to have full access in the community. They're fully included. People are working if they want to work. They have relationships with other people in the community, and it's not just about that day program site. It's not saying we can't have sites. For some people, that really is necessary to empower them to be part of their community. So we're really looking at on a case-by-case basis. It's not about how many minutes a day are you in a certain location. It can't be boiled down that black and white. But we're moving, you can think about moving from like a program perspective to a more individualized supports. And I use the word supports quite a bit when I'm talking about this, because that's what the services and support should be. Our vendors are not here to control anybody, to control anybody's life. We're here to support people to live their best life. So this is hopefully a way for some accountability to make sure that that's happening. You know, it's not new that we want to be pursuing person-centered planning and to have individualized services, but there hasn't really been a mechanism for accountability as much as we're going to have now. Also, it's interesting to note that, you know, we have our Lanterman Act in California that talks about person-centered planning, but this, you know, as CMS is going to affect the whole country, and so this may impact more states more than us, or, you know, in different ways than we're going to be experiencing. So, you know, how is this going to be impacting different people on the planning team? So if you are a person receiving services from the regional center, or if you're a family member, think about what is important to you, right? What are your goals? Where is it that you see yourself in 5 years or 10 years? And are the services and supports helping you to take steps towards those goals? Are those things that are in your IPP? And we'll be talking quite a bit as we go through the presentation about things that you can be asking and including and discussing. So providers might be updating some of the way that services are provided. There may be more individualized options. There may be more community-based options. We've been seeing a lot of momentum going that way over the past several years. Service coordinators, you're going to be getting a lot of questions, I think, from providers as well as from family members and people who receive services. You've got a lot of responsibility in writing the IPPs and making sure that things are included to give providers direction about what's expected of them and how they can do the job we need them to do. And for everybody, it's really important to think about the desired outcomes of the services and supports. So why is someone receiving this service? Why are they receiving this support? And is it helping them to accomplish those goals that we were talking about? So a lot of times we focus on what do we need right now, because that's important. We need it right now, right? But we shouldn't neglect thinking about those longer term goals as well, because we can be thinking, even if it feels so far away, what would it take to get there? Because having those conversations will lead us to finding the pieces of the puzzle, right, to lead us in the right direction. I might have a great day program experience currently, but it's not providing the training for the job that I want in the future. So is this the best setting for me right now? Is this where I want to be in 5 years or 10 years? So having those conversations, including some of those things in the IPP so that providers know how they're helping the participants along the journey, right? What accommodations might be needed, right? What skills are we training? What are we gaining and learning so that we can be ready for those? Okay, so that takes us to our first question slide. Do we have any questions? I would love to hear from you. Go ahead and unmute yourself. I can't access the chat myself, unfortunately.
Katherine, if you take your PowerPoint down for a minute, then you can see everybody. There you go.
Oh. Okay. Can you guys see me okay?
We can still see your PowerPoint.
Oh,
So,
that's
can you just
interesting.
click stop share?
Stop share. There we go. Okay.
There we go. Now we're all back.
I see hand raised, Keisha.
Hi. So this is something that's been talked about for a while with me, or that I've been aware of, but I never fully grasped it until I saw you speak. However, I get it. I understand it now more than ever. However, what about those that the existing programs, the adult day programs, meet their needs? It's exactly what they need. and it could possibly be what they need for the next 50 years. Does it have to change for everyone? That's what I'm trying to understand.
So, I mean, I think we don't want to see changes that are making things more difficult for you, right? If it's meeting the needs, we don't want to lose what's good, right?
Mm-hmm.
But can we be improving for everybody across the board? You know, you may be 100% happy where you are. If you have more options, that doesn't take away from that. We don't want to take that away from you. And I think having the conversation with the team about what is it that does make it work right now. You know, is that something that we've identified? Is it a relationship with a specific staff member? Is it the certain structure and routine of the day? Is it location? You know, what are those things that are kind of the magic for you that makes it work so well? But if things are great, that's wonderful. That's good news.
So is 100% of adult day programs are going to have to be inclusive or include some sort of community involvement? No more are going to be what we have now, what we know now is not going to be anymore, correct?
So all of the settings will be required to offer that. So it's not going to be any day program saying you have to be in this location or in that location if you would rather be on site. So we're not going to say, oh, you have to go to the library if you hate the library. If you want to stay on site and work on your goals there, that will be an option. But for some people, that has not been an option. So increasing the options and really understanding from people, what are your goals? How can we support you, you know, on a more individual basis to accomplish that? That's what we want to see.
Okay, so then maybe you can strategically help me to understand this. Is this something that's being done for everyone is having to be involved because there's a certain number of groups that aren't already meeting those needs? That, you know, there's fantastic programs and there's not fantastic programs. So if there's programs out there that just aren't getting them out in the community or involving or being inclusive, this is forcing their hand. So not necessarily is it going to impact programs that are already doing that. Programs that are already going out and doing jobs and already going out and shopping or library or visiting workplaces or what have you. It's not necessarily going to impact them.
So what we want to make sure is that the services are meeting the needs of the individuals, right? And so if it is working really well, I would really encourage you to document what the choices are and how the program is meeting those needs. For example, I've visited one setting where pretty much all of the activity takes place all together at one location. It's not something you would look at and say, wow, it's so integrated, it's so community inclusive. They're really not traveling anywhere, they're not interacting with anyone other than their own group every day. So I was really encouraging them, like, what are some ways that you can, you know, provide some options for accessing the community? And what they told me, what the staff told me is that, well, this is what everybody wants. They don't want to leave. They want to stay here. I don't know from the outside looking in, is this the individual's choice? Are they on a day-to-day basis being given options to go out and do different things? Are they being presented with options that they're not interested in? Or are they concerned about transportation? You know, maybe I don't want to walk or take the bus. Maybe I'd be more comfortable in a vehicle, a car. What is it that is drawing everybody to want to have that site location experience? If it's not in the IPP, it's hard for me from the outside to assess, are you as a program not doing enough to offer choices, or are you offering and then the individuals are saying, no, we're happy here, this is what we want? So I'm going to talk a lot about incorporating these things into the IPP so that we can know individuals are being supported where they're choosing to be.
Okay, I don't really feel like I'm getting direct answers. I feel like I'm getting more of PC answers.
Okay, you know, we can maybe set up a time to talk individually, and maybe you can give me more specifics about your situation. So, and we may cover more of that throughout the presentation as well.
Well, that's just it. My situation, my personal situation is with my daughter. and things are great. And I've been feeling like the last 2 years when I do hear about this, that so much is going to be changed and forced on her for things to be different, rather than it being, you know, she has a good thing. Let's not mess with it, because we worked as a family so hard for so long to get where we're at.
Yeah,
And
I hear you. I hear you.
you know what I mean? And then also I'm an educator. And my goodness, I know from an educator's point of view, my point of view as a professional is I'm trying to meet the needs of everybody involved, and I can only do so much from my end. You know, when you've got exhausted families, when you've got families who have adults and have been working on this since they were 2 years old, and sometimes they just want to break and like ease up on them and quit, you know, changing things on us. I get that. I get that point of view from them as well as an educator. So I'm really concerned that things are being forced as a change, or, you know, but I also understand that in a government or a type of agency, that really to weed out the bad ones, the rule has to apply to everybody. I also get that. That's the real world. So, you know, maybe as we go, I'll understand a little more.
Yeah,
And
I understand when, go ahead, Sonia.
Yeah, Trish, I just want to say it's not just about the settings. It's not just about if you're in a segregated setting or a site-based setting, it's not okay. And if you're in the community, it is okay. Because there are programs where people are going out in the community every day, but they're not necessarily making the choices about what they do there, or they're always in a group and maybe their goals are not being looked at, or maybe they haven't worked on what their goals are. So it's not just about going in the community, but it's about what are your goals and what are you working toward. So it's not just about the activities and the location. And Katherine mentioned person-centered planning and person-centered thinking, and so it is a lot more about looking at the individual, not just, you know, you're going to this program and that's it. That's the goal, is going to the program, as opposed to what are you working on learning and gaining from going to that program.
Okay, so is it anticipated a lot more staff is going to be added, or numbers are going to be, the ratio is going to change for this sort of thing to meet these needs?
So we do have services available with different ratio levels of support. If the current levels are not meeting the needs of the individual, there should be that planning team discussion. Maybe someone needs one-to-one support. Maybe not all day, but maybe during meal times or on you know, activities out and about in the community, you know, and then maybe in other settings, they're great in a group. Make sure you're having those conversations with the SC, with the service providers. If there's something you feel isn't working, like, oh, well, we could be doing so much more if we had one-to-one, you know, the goal would be this, but this is kind of what we have. Maybe we're looking at an update, you know, a change to the service. If that's something that is not available today, you know, we have a needs assessment process at the regional center so that we can be building and developing those things to meet the needs that are out there. So that's where we need to hear from you. You know, what's working, what's not working.
Well, I can tell you, parents aren't shy, and I myself being one, and no problem asking, and it's often denied, or you have to fight. So it's great to hear all that, but the reality of it, you know, okay, I'll believe it when I see it, kind of thing, because been there, done that. And you know, other parents out there feeling the same way. I'd love to know that.
I hear you. There is some good news in that this is a new endeavor, and that the state does have to solicit public comment. So when they post the updated state transition plan, they want to hear from everybody that's impacted. And so that's a really important place to share your voice, to be heard, and to make sure that you're on the record saying this is what works, this is what we're afraid of losing. You know, don't take away the good things that we have in place. You know, this is what we want to stay the same. When providers are being assessed, if they're reaching out and asking for your input, you know, make sure that you're sharing that with them. And I will definitely share that information when that comes available to me.
Thank you.
Catherine?
Yes.
Go ahead.
Catherine, can I voice a concern? Is that it's what you just mentioned about petitioning the state kind of about grievances. I would, you know, that's a good path forward. Sounds like, but I also that's concerning to me because it sounds like that may be taking some of the onus away from like local local control and local regional centers and just say kind of just petition the state. Does that make sense? Like people are going to be worried about that.
Right. You know, I do think it's good that there's a place people can share their experience with the state, their opinions, their ideas, their questions. What I will say is that the place of the greatest control is with the individual program plan process. So when you're meeting with your service coordinator and talking about what's important, if it's important to you, you know, ask that it be included in the IPP. And so that is where everybody comes together in agreement about what the services will be and how they're going to be provided. So if it's important to you, include it in the IPP process.
Thank you. Okay.
All right.
Katherine, we've got one question about basically how does this apply to SLS, to supported living services, and some areas where there are no options for those agencies. Does HCBS cover SLS in some way? So I want to put that one question out there. And then I also wanted to just say that this is really, all of HCBS came about pre-COVID. So we understand that there are so many challenges right now during COVID to community access. So we understand that, and we can't really address those challenges. This is kind of HCBS in the world before COVID, and hopefully we'll get back there sometime in the near future. But we understand that there are all sorts of challenges with community access due to COVID.
Hi, this is Miriam. I don't know if you can hear me.
Yes, we can.
Yes.
Wonderful. Sorry, it's not appropriate for me to be on camera, but I wanted to come in and just chime in. I heard everything Tricia said, and oh my goodness, I work with parents, I understand. I also heard everything that was shared, and I'm sorry, I'm forgetting the name of the presenter, but it was so clear. As a service provider, I just want to say, wow, what an amazing challenge. We write program designs. I'm writing right now for a senior program for our adults who can't be in day program, and what this is telling me is, you better get really creative, bring this to your executive team, to all the directors, and say, guys, of course we're talking pre-COVID and after COVID, hopefully. If we're going to consider any new programming, or as we look at our existing programs, even if our participants say, well, we don't really want that, are the options there are to go out into the community to get jobs? And so all this is doing for me as a service provider is lighting a fire to say, we have to be as creative so they can do whatever they feel like doing out in the community, as opposed to just the traditional, well, if you know what I mean. So I just want to thank both Tricia, excellent concern. My parents would have that concern. I don't want things to change, but thank you to the presenter, because as a service provider, we better step up and provide as many options so that we're in compliance. So thank you.
Yeah, thank you, Miriam.
Hey, this is Rick Hodgkins. I've been waiting for a long time to speak, and I want to talk about this from a client's perspective. I've been in Pride Industries, and I've also been to Aim Higher, and I've talked about Goodwill on another webinar with regards solely to employment. And I want to tell you that when it came to programs like Pride Industries and Aim Higher, I was told, quote, you have no choice, you have to stay on site. So not everyone, you know, regardless of, some clients are actually told you have no choice. It doesn't matter what you think your goals are. We're going to write goals based on what we observed from you during the day. It's not what goals you want. It's what goals we think you should have based on your behavior, based on how you act. Why do you think I acted the way I did when I was in those programs? Because I didn't like it there.
Yeah,
Not everyone
that's a good
needs
perspective.
a place to go just to go out of the home. Some people want to go, some don't want to be in those programs. That's my experience. So thank you.
Thank you, Rick. Can I answer back to Nancy's question really quickly about SLS? If there's a need for a service that isn't currently available, please make sure you're letting the service coordinator know and that they can communicate that back with the Community Services Department. If you're with Alta Regional Center, we have a very specific needs assessment process. Other regional centers, I can't speak to their specific process, but that should definitely be identified in the IPP as a goal to be moving towards.
Katherine, let's move along a little bit here, and then we can have another break for more questions.
Sounds
And could
good.
everyone who's not speaking go back onto mute, please?
Yeah, I think we're pretty good right now. Thank you.
Okay. Let me see if I can get back to sharing my screen. Oh, there it is. Okay, so in the interest of time, Sonia, instead of maybe launching the poll, we can have people contribute to the chat box. If you think of the word community, what's the first thing that comes to mind? You know, how would you define that? If I asked you what community is, what would you say? You know, as I had mentioned before, Title 17 says a community-based program just means not in an institution, but that doesn't really indicate anything about what it is or what the experience should be. Does community mean places? They're the places that I go. Is community the people that I spend time with? Is it the groups that I consider myself a part of? It could really be any of those things, right? It could be all, it could be a combination of that. So when we talk about a community life, you know, the final rule is about making sure people have access to all the benefits of the community. But it's not just, I used to be at a site and now I can, you know, go to Starbucks and that's community. It's so much richer than that. It's being connected, right? It's being a part of things. It's them being a part of your life and you being a part of their life. And how much of that you want or what that looks like, it's going to be different for every individual. So that's why we do need those individual program plans. We need services that are tailored and plans to help people continue to make sure those don't get lost, you know, if it is working. And really making it about the individual person and individual community. It's going to be different for everyone.
Katherine, I'm going to read a couple comments because I don't think you can see the chat.
Right.
I'm just going to read the phrases that people have put in. People, our village, engagement, school and friends, helping neighbors, inclusion, people that have the same interests as me. Community is interacting with others, whether in a building or out in the neighborhood. Joshua says, able to be out in public and go where I want to go. My home, program outings, their own room, and TV watching. Strength, jobs, church, organizations, and recreation.
Wow, that was awesome. Such a variety of answers, and they're all right? So thank you, everybody, for participating that way. So if you've had experience with community care licensing, they license care homes, they license certain of our day program sites, and when they are doing their assessment of a site, a lot of times, you know, they go through the list, and it's kind of the comment that people make to me is that licensing comes in and they check how hot the water is. That's, you know, they're checking the temperature. And that's important, that is good. But it's kind of indicative that there's a very clear health and safety focus to the assessment and accountability of our programs. It's needed. There has not been as much of a focus on quality of life in other ways besides health and safety. You know, relationships, connectedness, you know, are people happy where they are? Do people have friendships? And so, in addition to people being healthy and safe, the final rule should bring along that richness of life and making sure that is taken into consideration when people are being assessed there. So I'm going to talk to you guys about some of the specific components of the final rule. I'll go through a few of these and then we'll take another break for questions, okay? So the first one talks about a setting being integrated in and helping individuals to access the community. And so people receiving services should have the same access to the community as anybody else. So that involves services, getting a haircut, going to the gym, going to the doctor, activities, things you do for recreation, relationships, working jobs. Those are all examples of community-based activities. If there's a day program that serves people that are interested in getting in shape, are they getting some exercise equipment and putting it in the site and they're there at the site all the time? Or are they supporting people to get a gym membership and go work out at the gym alongside their neighbors and their peers? There's ways that people can provide support in more of a community-based setting than has happened in the past. So as a part of the planning team, how can you be incorporating this, right? If you're not the service provider specifically designing the schedule, what do? You know, you have those conversations about how do you want to spend your time? You know, what do you like to do every day? Who do you want to spend your time with? What kind of support people do you click with and feel like, you know, they help you grow? Who do you want to spend time with as a friend? You know, who do you want to build a relationship with? And what kind of support do you need so that you can be healthy and safe as you do those things? So the provider should be supporting community inclusion and not be a barrier. It's when, like Rick said, people are being told, you can't do this, you don't have a choice. That's where there's a problem. If someone does prefer to spend more time on a site, that's fine, but it should be driven by the individual, not by the provider telling them what they have to do or what they can't do. So a lot of these things you'll see, there's kind of a shift from, it shouldn't be the provider saying this, it should be the planning team and the IPP process guiding how services will be provided. So the next one has to do with the person-centered plan. This is how it's written into the final rule. For our purposes, we look at the individual program plan as our regional center document, and that's where we want to see that we do have documentation about what the services will be and how people are going to be spending their time, what kind of support is going to be provided. Oh, I just lost my presentation. Oh, there we go. What are the goals and how does the service help us to get to those goals? So a lot of times it can be easy to look at the need that we have today and think, okay, how can I meet this need today? I finished high school, I need some place to be during the day. What do I do to spend my time? What are the vacancies? I would get those calls pretty regularly when I was doing day program vendorization. What day program has a vacancy? And my first question is, well, you know, what do you want to do? How do you want to spend your time? If it's an art program that has a vacancy, but you hate art, it's not going to be a match. So tell me about, you know, what the interests are, what kind of support is needed there. And let's start with that and then see how we can build something more individualized. One of my favorite examples was from when I was a service coordinator and I worked with a young man who, his dream was to own a ranch in Idaho. I don't know if you've been to Idaho. It is gorgeous scenery. I would love to be on a ranch in Idaho. That sounds lovely. However, as a service coordinator, I can't make that happen for you. I don't know how to help you with that. But through the conversation in the planning team, we talked about the love of the outdoors, right? You know, I don't want to be in an office all day. We talked about loving animals, you know, and being able to work with your hands and that kind of thing. And so, you know, I thought about it, and there's a day program that had horses, and it's a behavior management program. It wouldn't have been a fit for this person to come as a participant. However, we started thinking these horses need care on the weekends when the day program is not taking place. And I actually helped this young man get connected with a job coach where he was able to get employed caring for the horses at this ranch over the weekends. So he got to work with animals, be outside, get paid for it. And it's not something I ever would have been a part of if we'd been looking for where's the vacancy, right? So letting that goal guide the conversation that we're having and pulling in our resources. You know, what would it take? You know, how can we work together to take steps towards that? Okay, the next section has to do with rights. The final rule protects an individual's rights to privacy, dignity, respect, and freedom from coercion and restraint. So hopefully this is happening currently. Sometimes people say, oh, the final rule is not in effect until 2023, right? Well, it is in effect now. Hopefully we're respecting people's rights now. If people have to make some changes about certain parts of their program design, they've got a little time for that. But these are things that everybody has a right to. So if you're seen in a setting, in a service situation where there are some things you're not comfortable with. There may not be the privacy that you want. Maybe you have concerns about the dignity or respect, or people are feeling some coercion because they're with the group and maybe they don't want to do what the group is doing. These are things that we need to talk about, right? How can we change things so that people do feel they have their rights respected? So part of that is, training on the part of the service providers. Part of that is supporting people to know what their rights are and helping them to advocate for themselves to know, yeah, this is what I want, this is what I need. Part of that is supporting people to be as independent as possible, to not be dependent on staff, to providing those accommodations, accessories, technology, training, and giving clear guidance to the service providers. And a lot of that is through the IPP. Don't overstep, support as needed, but support people to really fully thrive and be as independent as they can. Independence is huge. Being able to make life choices about what you do every day, where you go, who you spend time with. I spend a lot of time talking with providers about specific examples and how this applies in their setting with their participants. And this is, one of my things about SLS. It is an individualized service. It may be one-to-one staffing, but our choices being respected? Is independence being supported there? Maybe, maybe not, right? So if not, then we need to make some changes. There can be kind of an assumption sometimes that those smaller ratio, one-to-one, or maybe a home with 4 people, it's going to be more individualized than a home with 10 people. Sometimes I think maybe it could be easier, but that doesn't necessarily guarantee it. So having the conversations about what the individuals are really valuing and need on an individual basis. There was one home I visited where they were telling me, oh yeah, we are very involved in the community. We support our residents here. They all go to church every weekend. And they were telling me how the individuals all go to the same church. And so I was asking, is that the church that they all are picking? Because it's a little surprising to me. 4 different adult men with different backgrounds, ages, family history, that kind of thing. They just happen to choose the same church, because I know a lot of people in the same family that, one likes this music, one likes that music, this kind of preaching, that kind of preaching. So is it really that they are all choosing that, or is it that the staff only has to drive to one location, and so that's being maybe pushed a little bit by the home? Oh, no, that's what they're choosing. That's what they are preferring. Okay, maybe so, maybe not. I want to make sure that their choices are being respected. Church choice was not in any one of their IPPs. So I don't know if that was truly their choice, if they had been offered other options, or do you want to go visit other churches in the neighborhood, or do you feel like this is where you have to go, or is that where you really want to go? But these kind of things that can be a big part of quality of life, we need to know that people are being supported according to their choice and preference. Okay, so those things that are important to you, those things that can make your day or break your day, if these are things that the service providers need to know to be able to do and incorporate in their services, have the conversation, document in the IPP. It's so, so, so powerful. It's what I tell the providers. It's what I'm telling you guys. That's what I'm telling service coordinators. Please document in the IPP as well as you can, because that really is the roadmap for what services are going to look like. Okay, and number 5 has to do with individual choice regarding services and who provides them. So, I mean, we really don't want to hear anybody's feeling stuck, that they were placed somewhere against their will. People should be in environments where they want to be, that they selected, that they're enjoying, and that they're growing, hopefully. So if that's happening, Great. If not, what steps do we need to take? And are we comfortable with the individual staff that are providing support? You know, maybe if I need assistance in the restroom, I might be more comfortable with a female than a male helping me. You know, are those choices being respected? I've seen some settings where in staff interviews, before any new staff is hired, the current participants are part of that interview panel. Like, we want to see, are you someone we want to work with? Maybe, maybe not. And I thought that was really powerful to show, you know, who the staff are there, you know, to be there for. And finally, is the grievance procedure working? All of our providers have a grievance procedure. And so this is a really powerful way for people to advocate for themselves and to have a voice if things are not going the way they want or they need to be going. To document, this is my concern, and to know that it will be addressed. Not that everybody can get what they want all the time, but there is a process to do that. And so I encourage providers, make sure the participants know how to file that grievance. And, you know, anytime you've got more than 2 people, you're going to have differences of opinion, miscommunication. So we don't expect that nobody's ever going to have a disagreement, but knowing how to express yourself when you want a change to happen, that's such a valuable skill for everybody, for all our spheres of life, right? So this is a really important piece of it. There are multiple ones specific to residential settings. I'll go through just a few of these briefly. Legally enforceable agreements. For the regional center system, we're looking at signed admissions agreements, making sure we're talking about what we're signing our name to. We're not just flipping the pages and signing at the back, but we're really having a discussion about what people can expect of the services, as well as what's expected of you if you move into a home with other people. An expectation for privacy. Privacy in the restroom when needed, privacy, you know, in your phone conversations, when you're spending time with friends, that kind of thing, that privacy is being respected. Lockable doors. This is one of the big changes, I think, for a lot of folks, that now it's saying bedroom doors as well as bathroom doors should be lockable, right? And so there are some changes happening in care homes. They're changing the door lock. So the individual should have a key, or as is workable for them. You know, if a keypad is easier than carrying keep track of a key everywhere you go, that's fine. I've seen some people do like a card key that you might see in a hotel. It's not saying that doors have to be locked. Staff will have access, you know, a copy of the key in case of emergency. People can keep their door unlocked. They can keep it open if they prefer. But unless there's a specific documented safety issue, that should be the expectation across the board. You know, if you are someone who works with little kids in a residential setting, maybe for a 3-year-old, it wouldn't be safe to have a lockable door. That should be the conversation in the planning team. Maybe a 17-year-old might be more appropriate for them. It really needs to be handled on an individual basis. And again, we're moving the conversation from the individual provider saying, I am going to do this or I'm not going to do this, to the planning team saying what's best in this situation, right? Individuals have a choice in residential care if they prefer to have a single room or a choice of roommates. Okay, this is not saying that care homes all have to provide single rooms, although we are vendoring more that do offer single rooms. But if someone wants to have their own room, they have the chance to say, you know, this is my goal, this is what I want to move into. People should be able to furnish and decorate their rooms according to their own preference, their own taste, bring in their own furniture if that's what they prefer. It's their home, right? To control their own schedule. You know, if you might want to eat dinner at 5 p.m. and he might want to eat dinner at 8 p.m. and it's both okay, right? Both of you have the right to eat dinner when you prefer. Access to food at any time. Food, snacks, we're not denying people access to food without something really specific and unique like a doctor's order about calorie counts or that kind of thing, but that's pretty rare. Right to have visitors at any time. This is a bit of a change as well. There used to be visiting hours posted. That's something that licensing would ask homes to develop. Now we're looking at it a little bit differently. People do have the right to have visitors late in the evening if they prefer. Now, because it's a shared living situation, just like you and I might agree if we're sharing a house together, hey, I have to get to bed early because I work really early in the morning. If you could please keep it down after 9 o'clock, I'd really appreciate that. You know, the residents of the home can decide among themselves, these are the quiet hours we want to agree to because we respect one another, right? If you've got a bunch of early birds and one night owl or vice versa, it might not be a lot of harmony in the home, but it's the residents that are driving the decisions that are being made there. So looking at care homes specifically, you know, if I'm going to talk to a provider and see, you know, what tweaks might you want to make to your services, you know, with the final rule in mind, one of the first things is, you know, when you walk in the door, does it feel like home? Right? Does it feel like a facility? Do you walk in and you see, you know, the labor laws posted, or do you walk in and it smells good and you see nice art on the wall? I mean, those things that have to be there can be there, but it doesn't have to be, you know, the first thing you see when you enter. Are people provided support as needed to pursue their choices safely? So it's not the staff's job necessarily to say, no, you can't do this or you have to do that, but to encourage healthy choices. You know, maybe, well, they shouldn't be dictating to anyone, well, you can't have that ice cream for dessert. But maybe if you know you've been on a diet, would you rather have a piece of fruit? This apple looks really good. Or, hey, how about a little ice cream and then we'll go on a walk to get, you know, the exercise going, bring that blood sugar down. So teaching that moderation, offering those healthy choices without having too much of a controlling influence. Our staff provided with guidance on how to support respectfully. Maybe not all of the staff that come in know what some of those options should be that they could offer. So give people some tools on how to support folks. Are regulations being used to restrict choice? This is an interesting one because you know, homes are under community care licensing regulations, and there may be regulations adopted to keep a lot of people safe that aren't necessarily promoting independence for other people. And one of the examples I have with that is the use of knives in the kitchen. Right, so it is a requirement that knives are locked up because they could be dangerous. I don't know about you, but I don't have my knives locked up at home. I don't think I've ever seen any of my friends lock up their knives. It's kind of specific to licensed facilities. And I was visiting with a home that the residents love to cook and they all could handle knives very safely. And for them, it was just cumbersome. Like, why do we have to go unlock a knife? You know, we're all safe and comfortable handling them. And so the home was approaching licensing for to request a waiver. Can we have a waiver on that requirement for this home, for these specific residents, because there's no need to have it locked up? And so I hadn't heard the results of the application yet, but I'm very curious because generally licensing is supportive of promoting independence when it could be done in a safe way. And also, who makes the house rules? When we're talking about visiting hours or quiet hours, it's something that the residents should be doing as the residents of their home. It shouldn't be dictated to them. Okay, one more and then we'll take some questions. So you may have heard some things I've said and thought, oh my gosh, that would never work with this person that I'm thinking of. And it really worries me. What if they lock themselves in their room, or what if they're, you know, eating things they shouldn't be eating, or spending time with someone they shouldn't be spending time with? There's a concern. There is, this is not a reason to throw out care for people. This is not a reason to stop supporting people that need support. It's not a reason to neglect anybody. We just want to make sure that there has been a fair discussion of what the issues are, that we're exploring less restrictive methods of meeting the need, that we're providing training when possible. And sometimes maybe unlimited access to food is never going to be safe for someone with Prader-Willi, for example. We're going to have a doctor's orders about diet and that kind of thing. We're going to be documenting the IPP, right? And we'll be reviewing that need regularly so that something that may have been an issue a year ago, it might not be an issue anymore. Maybe this is something where we could lift those restrictions. So there's still going to be a way to provide the support where it's needed. But it does need to be addressed on an individual basis. If we're going to have a specific diet for someone with Prader-Willi, if it doesn't apply to other people in the home, you know, it's got to be individualized in how it's applied. So hopefully that provides a little peace of mind for those of you that are going, I know, because that's kind of where our minds go, right? So I will pause right there. Let me see if I can exit my screen sharing and take some questions from you guys. Sonia, do you want to maybe read a question or two from the chat?
Yeah, and we still have people joining us, so welcome to all the folks who have joined us in the last few minutes. If you do need Spanish interpreting, translation, then click on the globe icon near the bottom of the screen, and we do have a simultaneous Spanish translation happening in case you need that. There have been a couple questions, Katherine, and they were kind of clarifying what you meant by residents, and I answered some of the questions hopefully correctly. Michelle or Cindy, feel free to make any corrections as well. Just clarifying, you know, what you meant by it's not everyone's home, it's licensed residential care homes where you were talking about, you know, the locked doors and all of those examples. And we're not going into people's private homes and controlling
correct.
what they're doing.
These are requirements for the vendor licensed care homes. They're not private individual family homes.
Right. We have a question, knife lockup. We have no problem with our knives out, 7 years now. That's great. And I do want to kind of bring up the question of choice again. Georgina previously had mentioned discovery. And there's sometimes we think we've given people choice, like you said about going to church. And maybe everyone said sure, but were they making a choice based on what they really knew? Were they making a choice based on different options? Did they get to go to 2 or 3 churches and then choose the one they liked the best? Or did they just go to one church and everybody said, okay, sure, we'll go every Sunday? So there are different levels of making choices. And sometimes, I mean, all of us change our minds, right? We might like something this month and then next month go, I'm done with that, right? I did yoga for a month and I'm done with yoga, right? Or I like this church, but now this pastor, you know, I don't want to hear this sermon anymore. So maybe try something different. You know, whatever it's about, we have the right to change our minds and to make different choices. And we also have the right to try things, and we have the right to fail. We all learn by trying things and maybe not doing so well at something. And are we all in our first jobs that we ever had? Mine was at Taco Bell, okay? I did the drive-thru at Taco Bell. Am I still there? You know, it wasn't a failure. I learned a lot of skills there. But, you know, I went through many jobs after that. So, you know, do we say somebody can't work because they just didn't, the first job they had didn't work for them? So I think that just really the idea of choices is giving people opportunities to try different things, whether it's in the community or about a job or things we're doing socially. Okay, you have a boyfriend and you end up breaking up and it's really upsetting. Well, are you going to try again? Or was it so upsetting you're never going to ever try again, right? So I just wanted to kind of amplify your points about making choices. And things need to be documented, but things need to be reviewed too, because they can change throughout the year.
No, I would like to say too, hearing your story about the person who was able to find a job, you know, working with horses. He wanted to own a ranch there. And I just think that it's like asking any of us, even myself, well, what do you want to do? What do you want to be? We don't know, you know, and I think especially, you know, I've done discovery with so many people. So it's about finding out what they're interested in, but what they're good at and how that can match up to those hopes and dreams, you know, so really not just I think we need to say that it's just so great that you were able to connect and know someone who, knew someone and make all those connections happen. But that takes a lot of time too, and a lot of effort, but a lot of time, and to give it the time that it takes to.
It's true. And it may be intimidating to be asked that question. If you've always been told your life, you're going to this school, maybe for day program, you've got this program or that program, like if that's been the level of choice you've been given, maybe I haven't dreamed about where I want to be in 10 years or what that could even look like. Sometimes we need, people that know us in our life to kind of come alongside and say, hey, every time, I see you listen to music, you come alive. Maybe it's something that has to do with music. Those people around us see when that spark lights up, right? It may be hard for some people to kind of get used to this. I've got an example about a day program that I was working with who had been providing art classes on site full-time pretty much, and they purchased 2 vehicles as part of their efforts to want to be compliant with the final rule of, we haven't done anything in the community, but we're going to start. And so they started, instead of the teachers going out to purchase the paint and the art supplies, then the participants would go, and they would go and go to art galleries, and they would go to the park and sketch what they would see. Like, there's so much outside of the 4 walls, right? Well, some of the participants there would sign, oh yeah, sign me up, I want to go on this particular activity. And then the day would come, oh no, never mind, cancel, I'm gonna just stay here. Like, it was kind of scary, to go and do something different. But over time, weeks went by, months went by, they saw their peers going and having a great experience and coming back and telling stories. They started going out as well and having a great experience. And so it wasn't something they were ready to do the first day. And that's okay. It takes some time to see, oh, do I want to try that? I don't know. Maybe I do. Maybe I don't. I don't know. But then being willing to give it a try. And then when there's success, like, oh, the world is opening up. It's so exciting. And for the staff to see the changes, like, it was so motivating to see, we're really opening up to new possibilities here. It was really cool.
Katherine, there's a question about how and when will residents who live in a care home find out about some of these changes that may be happening in their care home? And I know some of them are already happening and maybe have already happened, but can you address that question? How will these changes be ensured at the care home level, and how will residents be informed about them?
So it's a little tricky talking about this subject, because a lot of times people want to know, like, how do we check the box? How can we know, like, okay, we're compliant? Do I sign a form? Do I add this to my schedule? And it's really more of a philosophy. It's kind of an approach, right? And person-centered thinking and person-centered planning really is the foundation of all of this. So I really hope that at that planning team level, everybody will be talking about, what's working and what's not working, and what we want to see added, for quality of life, right? Like, what's important to you, as well as what's important for you, with the support that's needed. I see a reference in that to less restrictive methods, and just to share, if you're not familiar with that terminology. So for example, people have the right to have a lockable bedroom door. If for some reason that's not safe for somebody, it wouldn't be safe for them to lock themselves in the room or whatever. What are other ways that we can support people to still have security? Maybe having like a lockbox of they can secure their valuables, lock up their cash, their things that are important to them.
Give them the safe with the key.
Right. So there's other things we can do other than just saying, no, you can't have this. Okay, and we've got another question pop up. How safety-related relationship issues might be addressed if an individual receiving services continues to desire maintaining an unhealthy relationship. will there be increased healthy relationship training for consumers? And what are some ways that staff of vendor agencies will support consumers in making healthy decisions? So this is a great question, right? Because we may care about people that might want to spend time with someone we don't know if they're going to be a good influence, right? So I appreciate the question about training about healthy relationships, because that is something that Alta Regional Center offers for our clients. I think it's great. I think all of us can benefit by learning relationship skills. And so knowing what does a healthy relationship look like? What does an unhealthy relationship look like? We need to respect people and allow them to let us know what support is helpful, what that looks like for them. Do you want me to turn them away if they come to the door because you feel like they're putting pressure and intimidating you? Or do you want me to stay out of it and maybe I come alongside and I'm talking about things, but letting you make your own decisions? Because it's not the position of a service provider as an owner to dictate anybody's relationship. Regional center services are voluntary. And so people could decide, I opt out of the service anytime that they choose. So how can we be a support system to meet those needs in a way that still is respecting people's right to make choices about their own lives?
I love the example of I can't remember where I heard it, but one woman said, well, I want him to be my boyfriend, and that's my right, my choice. It's like, well, yeah, but he also has the choice to say no. So sometimes it's hard to understand these things. We teach self-advocacy, but there's two sides to that coin. But there's a lot of groups that also do healthy relationship trainings. I know we've worked in a lot of the local programs to come in and talk about relationships and other, I know that some of the programs do classes on healthy relationships and boundaries. I know some of the women's programs or local community agencies have come into some of the programs and done some work as well, Stand Up Placer and the main one in Sacramento, which I'm blanking out on. But a lot of them have curriculum that they can come in and work with people with developmental disabilities, and they're thrilled to do that and offer those supports just as they would to anyone else in the community. So again, it's not just what can we do inside, but what can we go outside? We can go out to other agencies that are working on safe relationships and saying no and saying yes, and how to have healthy sexual relationships. So let's use the community as well, because there's a lot of resources out in the community also. Should we do healthy relationship training? Absolutely, Nancy. Looks like Karen has her hand up. Karen, do you have your hand up and I didn't see it?
Yes. I have
okay, go ahead.
Okay, I have a couple questions, but first, the questions are related to the person-centered planning self-determination. I'm a parent of a daughter who is in the pilot program, and we as far as the program goes, we are running our program here at home, and of course part of the person-centered program is a lot to do with the community residential as well, which is very hard with COVID right now. But we are doing some, like going to the store, restaurants, food, stuff like that, going to church, some volunteering. But I'm participating in this because I wanted to learn more about the residential side and how it affects person-centered planning, because I do have a daughter who likes to lock the door in her bedroom, and I was concerned about that in residentials. Our goal, like you said, could be for 5-10 years from now is she lives independently, or she lives with roommates, or she lives in a residential, licensed facility. So the door thing was an issue. So I'm glad to hear that locks are on there. How we are dealing with that with the person-centered plan right now is we changed the locks backwards. We can unlock and unlock it from the outside, and she has the key to lock it from the inside. So she prefers it that way, and it works. So we have access to get in and out, and she has the key. So we do have, you know, copies of the keys just in case. But because we have the lock and unlock mechanism on the outside, it's working well. So that can be, I mean, a situation for any residential place, because it works for us. It might work for other people. The second thing on the residential is there are not a lot out there that probably fit my daughter's needs that are available. And I know that is an issue for a lot of people. My question is how and who do you talk to can your be a residential licensed facility where we could open it up if I had 2 extra rooms and I could open it up to 2 more people and hire staff. Is that something families can do? So
Let's see, if you're interested in providing services, contact the Community Services Department. I don't know if you're with Alta or another local regional center, but contact Community Services. They can talk to you about the different types of services as well as what the requirements would be. But I think that's fantastic. Yeah, please do reach out. We'd love to hear from you.
Okay, great. Thank you.
Displaying Karen Banaxi's avatar. Screenshot.
Oh, and I will just have a little side comment. I totally love that their family found a creative way to meet the daughter's needs with being in her room. I would probably steer care home providers away from doing anything with the lock that could present an appearance of staff locking a client in a room, because that might be considered a restraint or being locked in. Even if that's not how it's being used in practice, if it's perceived that way, that could be problematic for the home. So just to put that out there is talk to your service coordinator, talk to your community services specialist, if that's something that you're considering. All right, anything else before we move on? Did we get to everybody in the chat?
This is Rick Hodgkins here.
Rick,
Hi, Rick.
can you speak closer to the mic? It's hard to hear you.
I'm sorry, I have my phone on a stand because I'm multitasking and I want everyone to be able to see me as well as to hear me. But I kind of want to piggyback on a couple of things. Just like with part 1 of this series, just like part 1 of this 2-part series that we talked continuously about and nonstop about coercion and restraints. And I can tell you of a program that, while not funded through the Lanterman Act and by the regional center system, they continuously use coercion and restraints, perhaps not physically, but they use coercion. It's up here in Sacramento, we have what is called therapeutic recreation. We have what is called TRS, that which stands for Therapeutic Recreation Services. It used to be called ALS, that which stands for Adaptive Leisure Services. It's a division of the County of Sacramento Department of Parks and Recreation. And while they don't use restraints, that they still use coercion. And you go on, you know, outings and even take trips like to Disneyland or to Washington, D.C. or, you know, to Las Vegas. And they use coercion, and you're in a group with one staff. There's one staff to every six participants. And that, to me, is coercion. And I don't participate in those things anymore because it involves coercion. And apparently, I found out that the County of Sacramento does not want to be sued. It's a liability thing, so that's why they believe in the use of coercion as a way to control people. And I haven't seen. I know that when I used to get their flyers, it was addressed free matter for the blind. However, all I've seen on those trips was regional center clients. I don't see a single person without a developmental disability on
Displaying
there.
Lisa Cooley's video.
It's all
Screenshot, please.
it's
Active
all
speaker video.
it's all
Screenshot, please.
regional center clients. It's all regional center clients. And then of course we talked about Prader-Willi, and I got news for you. There is a medication out to help people like me with de Moorsier syndrome, causing hypothalamic obesity, and also people with obesity because of Prader-Willi syndrome, that will help us lose weight and control our appetite. We keep treating people like we keep punishing people with Prader-Willi syndrome because of their obesity, and this medication will, punishing people because of Prader-Willi syndrome, I'm happy to say will soon become a thing of the past, but that this is a subject for another day and another time. I basically wanted to touch on the two things. One, coercion, which I'm totally against, even in programs which are not funded by the regional center or Medicaid. And two, if there are sites that offer art classes full time, it might be a good idea. Clients that have made art pieces to, have their art, if they want to sell their art, that's a good idea for those clients to generate income and revenue. And perhaps if those sites if those day programs are providing art, why not, if there are clients that have a passion for food, why not provide culinary art classes and get those clients jobs in bakeries, restaurants, cafes? I mean, come on, this is the kind of stuff we should be doing. I mean, yes, there's American River College, and Cosumnes River College also provides culinary arts classes, but I had only one professor that was encouraging when I took culinary arts classes at American River College. The vast majority of them were not very encouraging. I mean, if we can't do that with these day programs that provide art classes, then the community colleges are going to have to step up to the plate and know about our population.
Rick, thank you,
Rick.
so
I wanted
much.
to circle back to something you said about coercion and how concerning that can be. And, it is a challenge as a regional center. We really don't have control over what other organizations may do. But what we can do is to talk about what coercion is and how to recognize it when it's happening. To talk about, is there any environment where you don't feel good about the way you're being treated, or you're not comfortable with how things are happening, and what do you do if you're in that situation? So that is something we can do. That's part of that healthy relationship class. That's part of self-advocacy. So this does kind of lead us right into our next slide, which is to ask you, I'll throw this out there and then I'll do my share screen. Of the topics that we've discussed so far, so coercion that goes with rights.
We have, the chat is being read somehow on audio. I'm not sure how that's happening, but it
Let
looks.
me turn off my phone. I'm sorry, my mute. Let me.
Oh,
unmute
thank you.
my
I think that's what's happening. Thank you so much, Rick.
My phone talks to me.
Okay, thank you.
Sorry about that.
Thank you very much.
Thank you. Okay, so we talked about community inclusion, person-centered planning, rights, independence, choices. Is there an area that really feels like it's the most important to you? Like, this really resonates. I want to learn more about this, or I'm really happy that things are improving in this area. Could you add that to the chat box, if you would?
Katherine, repeat yourself, just for those who were spacing for a second.
Sure. So it's the test to see if you've been paying attention all this time. No, don't worry about it. If you don't want to say anything, don't. But we talked about community inclusion. We talked about person-centered planning. We talked about rights. We talked about independence. We talked about choice. So if one of those stood out as being most important to you, I invite you to share. And Cindy, in just a minute, maybe I can pick on you to share some of those since I can't see the chat box from where I'm at right now.
Okay, so I'm going to go ahead and start sharing some of the things that people have put in the chat. Choice, community inclusion, person-centered thinking training, person-centered planning, choice again, my health and well-being, the community, choice and independence, and how they will both be able to occur with the final rule. And from a parent's perspective, a person-centered planning, choice again, connection to show up all over California by Zoom for my son and my community, healthy relationship training, independence. And I believe the next one is a question, healthy relationships.
So you can see there's such a variety of topics that are really hitting home. And I mean, there's been so much that we've talked about already. And hopefully you guys feel like when you're in that next planning team meeting, maybe you know some other questions that you can be asking about, you know, well, this activity really isn't my choice. What are my alternatives? Or how can I be pursuing this goal? Or what choices do I have? Maybe I don't even know where I want to be in 5 years. How do I even start thinking about those kind of things? So even just starting to think about it, that's a step in the right direction. So I want to give you guys some tools, right? We've been talking about being person-centered in our approach. And you know, our IPP process should be person-centered in the way that it's done. But I think person-centered practices are an area we can all always be growing. We could be more person-centered and more aware of how we're incorporating that. So I will encourage you, if you ever get an opportunity to take part in a person-centered thinking training, the learning community has developed a fabulous curriculum that are presented from time to time in our area. And now on Zoom, maybe you can find it even from someone outside of our area. It's so valuable. There are a lot of really good tools and just some good knowledge that can take you forward into effective person-centered planning. You know, be thinking about those goals and the outcomes that you hope to see from the services that you're receiving. You know, how does the planning fit together with what you're currently doing? One of the things I really advocate for is to have meaningful goals. When you're having an individual service plan meeting with a provider, maybe with the day program, for instance, what are those goals for the next year that are going to be in the ISP? And hopefully the participant is the one driving, you know, this is what I want to do and learn how I want to grow while I'm here. Sometimes I'll see goals that are kind of production oriented, like, you know, this individual will make 2 necklaces, you know, over the next time period. And I always want to ask, why 2 necklaces? Why is this the goal? What is the purpose? What are we getting out of this? Not that it's bad to make necklaces, that's great. But is there a reason that's driving that interest? Is it that the person wants to sell necklaces at the art show to make money? Maybe there's kind of an employment aspect to that goal. Is it that they love having things to give to their friends, you know, on their birthday, and to be building relationships that way? Maybe someone has a mind of a fashion designer and they love designing and bringing in colors, and they can be developing those skills. Maybe it's not about the necklace as much as sitting at a table with my friends and we're sharing beads and talking and catching up with one another, and that's where the friendships are deepening. So are there skills related to any of those interests that we could be focusing on? Maybe it's, you know, learning about fashion design and, you know, color theory and becoming more independent and going and getting supplies and setting up my workstation and all that. And yes, you will make 2 necklaces while doing those things, but that's the natural outcome, but we're still focusing on what growth is taking place. So having an outcome mentality, and when you're talking about developing those goals, why are you doing what you're doing? And we can work on that goal maybe in a variety of different contexts, but what is the purpose? It's really important.
Katherine, we had a question related to person-centered thinking, and it says, how can we access person-centered planning so that the IPP is better written and planned? So regarding service coordinators, and they're increasing their skills to help the family and the individual with that process.
Yeah, I would always start with training. Like I said, there's a lot of really great training that's out there. You know, be developing your own skills as a facilitator. You know, how can we be promoting a person-centered approach? Bringing the service coordinator on board as an ally and a partner, and talking about what is important and the things you want to see captured in the IPP. You know, sometimes, you know, people may come in to the role with different levels of experience with writing. And so it's okay to come back and say, you know, we talked about, you know, the specific goal, but it was never written into the IPP. Can we have that revised? It's okay to do that. You know, you are collaborating in this process. And if any of my case management folks would like to chime in, you're definitely welcome as well.
There is a question about, Cindy shared some resources, Katherine,
oh, great, thank you.
On a couple different websites, but there's another question about sharing some more resources about your favorite person-centered planning resources. For instance, I'd love to see some examples of exemplary plans and even videos of teams doing it well. Maybe that's something that you and Cindy can look into, and then we can send that out in the next few days, some other links. But there are lots of resources online, actually from all over the world. So you can Google person-centered planning. You can go to YouTube and search person-centered planning. There's not one right way to do it. There are lots of different methods, and there's different styles. It can be, you know, a year-long process, or it can be a one-evening process, and different ways of doing it. So there are different ways. I encourage all of you just to literally go to YouTube and Google person-centered thinking or person-centered planning. There's videos, there are trainings, there are different methods. So they're not all for people with developmental disabilities, but there's a lot of resources there. So, and again, some of them are in New Zealand or England or elsewhere, but a lot of great ideas you can get there.
Thank you, Sonia. Cindy, can I pick on you again to type in the name of Michael Small? Michael Small is kind of one of the fathers of person-centered planning in our country, and he's done a lot with the learning community and developed a lot of tools in the training that have come out. And I know I've seen some videos that he's put out of him leading person-centered plans, and I would be very surprised if you couldn't find them on YouTube. I don't think I have a link for you immediately, but I would bet if you Google Michael Small person-centered planning on YouTube, you will find something of interest there.
And before I promise, is it okay, Katherine, that we share your PowerPoint when we share the link to the recording?
Yes.
Okay. All right. So tomorrow, when I share out with you all the link to the recording of today's training, I will include Katherine's PowerPoint attached to it.
So one of the elements of a good plan is not just talking about where we want to go, but how we're going to get there. And so one of the ways we talk about that is who is going to do what by when. And so that's something you can talk about in your planning meeting. Maybe there are certain things that a service provider will do. There may be things that family members are doing, and maybe individuals, you know, I'm going to spend some time working on this or looking into that. Everybody's working together, right? And so if that's written into the IPP as well, there's kind of a clear framework of everybody's role, because it can get discouraging if every year around my birthday we get together and I tell you, I want to do this, I want to do this, and nothing ever happens. Eventually, you know, I'm going to give up. I'm tired of talking about this thing that I feel like is never going to happen. But having some next steps of, okay, this is the next thing we're going to do. Who's responsible to make it happen? So it's a little bit more clearly laid out, and having that path, that roadmap That's a good way to use the documentation to support the plan, right? To bring it to reality. Because if it's just on paper, but it doesn't happen, you know, it doesn't do anybody any good. So I really encourage you, don't wait for somebody else to tell you how HCBS compliance is going to happen. Don't wait for the service provider to say, well, we're going to change and this is how. Don't wait for your service coordinator. Don't wait for anybody to say, this is what I want. Help me figure out how I'm going to get there. How can we build a plan and move in that direction? At a lot of my trainings, I ask people, have you guys been talking about this stuff in your planning team meetings? And a lot of people say, no, it's never come up. So you get to be the ones to start at your next meeting. Bring up some of these things that are important to you. Maybe that thing that you just mentioned, choice is more important. These are some areas I'd like to have more choice in my life, or this is where I feel like I'm not getting to make choices. Be the one to start the conversation. And if people don't know, what is this final rule? What are these changes? You can send them my PowerPoint. You can send them the link to my video or my email, or you know, you're getting the conversation started, right? And so I think it's picking up momentum, and people are getting more and more of a sense of what direction this is going. But there's still a lot of people that haven't started bringing it to that planning team level yet. So it can feel a bit overwhelming sometimes. We recognize that there are some challenges to getting where we want to go. And so, you know, we don't expect we can wave a magic wand and say, oh, this is what we want. So automatically we have, you know, all the SLS and care homes, you know, more than we need. You know, we recognize that we still have some capacity to build that way. We recognize that transportation availability has been a challenge a lot of times. Maybe I know where I want to go, but I don't know how I'm going to get there. Maybe I have a great day program, but I'm on the bus for an hour and a half. That is not the way I want to spend my day. That's a challenge. Day program ratios. Maybe there's things I could be doing differently if I had a different ratio with staffing. Rates, you know, what programs are being reimbursed to do their services. That's out of the regional center's hands. That's set by the state. So that's something to take into consideration. Location, you know, where a setting may already be located, they might have challenges there. If they're not located next to a bus stop, you know, near public transportation, there's going to be limitations to how you can access the community, right? And then also expectations from community, participants, families. Everybody comes in with their own set of expectations of what a service might look like or what things should be like. And if those don't align, it could be a challenge as well. So it's a hurdle. It doesn't mean we're going to stop. It just means we're acknowledging these things and we're going to continue to do what we can. So I've tried to compile some tips for you guys. I think a lot of this stuff we've already talked about, and you'll be able to see it on the PowerPoint when Sonia sends it out. But I want to make sure that we get to you guys and to talk about your takeaway from tonight. What is it that you are fired up to do? What is it that you feel like, okay, maybe I can't do everything, but I can start with this. Where are you starting? Would you share that with us?
Please feel free to go off of mute and go ahead and share your thoughts that you have, or you can type something into the chat box. There was one question that I do want to address, and that is how will self-determination meld with this? Self-determination is a whole different program. And we will be doing a lot of trainings in the spring about self-determination. Again, you can also go on YouTube, on the internet, and Google about self-determination. You can go to Alta's website. There's a page, maybe Cindy could post the link to the self-determination section on Alta's website as well as DDS's website. There's a lot of trainings and a lot of information about self-determination. That is separate from HCBS. So tonight we're not focused on self-determination, but yes, there will be there are direct ways that they do interface with each other. Self-determination services do need to be compliant with HCBS settings, so they do need to be integrated into the community, individualized, and so on. So, so there is a connection between the two, but it would take a whole nother hour or two to talk specifically about self-determination. So keep, you know, go do your research online, or check back, you know, keep an eye out for additional trainings around the state on self-determination. You can also always contact your local regional center and get in touch with the local self-determination advisory committee, which is already working on self-determination issues.
Yeah, and I would just jump in and add to that to emphasize any services funded through self-determination would still be held accountable to these same expectations. So this does apply to any self-determination services.
I'll read some of the comments since you can't see them. My goal is to live in my house with an ILS worker, I believe she means, right, Nancy? I would like to review my IPP and my ISP. With COVID restrictions, it's just about impossible to get started. My son wants a place of his own, so COVID is definitely putting slowing down some of those steps. I'm disappointed that homes and programs have to be told to do this, that it's not being practiced already. And that is not to be said that many programs are doing wonderful programming and support and respect choices. So please don't think that every program in home is not doing this. There are many, many excellent programs and excellent staff. But there was a question above that maybe Katherine, you could address. And that is, it's kind of hard to discuss short and long-term goals with my level 3 individuals in a level 3 care home when they don't even know what day it is. Do you want to talk about that a little bit?
You know, talking to people about the future, you know, we all may have different interests in doing that, different conceptions of what that means. You know, not everyone conceives of what 10 years from now looks like. Not everyone is able to express that verbally. And I think that's the value of a team. You know, it's not just one person. I think so much of the final rule is about it not being about just a service provider being responsible to figure it all out and, you know, implement this at their setting. It's about the team and having a plan with the IPP and, you know, really thinking about, you know, maybe you've observed, you know, this individual, they may really love their housemates. You know, that's their adopted family. Maybe they want to still be living together in 5 to 10 years. So how can we support them to do that? Maybe you see, gosh, this person hates other people being around them in the morning. Maybe they really would be happier, you know, in their own apartment. You know, what do you observe as you get to know this person? And if a change in setting would seem to fit what they would express if they could, that's something you can talk about pursuing, you know, as the team. But having the conversations, observing where do you see people, you know, at their happiest and at their best. You know, some people are introverts, some people are extroverts, some people are morning people, some people are night people. Some people love being outside. Some people hate being outside. You know, and when we take these things, you know, all together, it kind of guides us into helping someone to live their best life.
Can I interject a little bit there on that topic?
Sure.
I am muting myself. You know, I understand the point of view in the question. However, changes can be made with just that attitude and the wording. How do you help someone who doesn't even know the day of the week? There's obviously that person has many more needs and many more ways that need to be helped. And again, what Katherine said about it's a team effort. But you're talking about, you know, goals that can be made that you're out of bed by 8 a.m. and ready for your day. Everyone's goals are different. And everyone's goals need to be respected, and everyone's goals are important, and just as important as someone's goal is to, you know, have a farm in Idaho. It's putting it on the spectrum of whether one's more important or the other is a good way of starting, of throwing that out the window. And being an educator, and I put it in comments earlier, someone asked about training, and teachers are taught this, to set goals, and taught how to break it up and benchmarks, and they literally take classes on this in college. So it's really kind of unfair in a way. They have an upper hand where your adult clients have been in school probably since they were 3 years old with trained professionals that were taught in college how to set these goals and how to take data and then have support with their own staff in their own classroom, and then that hopefully easily transfers to the next classroom. Adult providers don't necessarily have that, and if you do have it, you might be unique. So I think it's going to be the responsibility of the regional center to definitely provide those trainings, and it doesn't have to be a college course, but it can literally be an actual listen, this is how we do it, this is a great way to keeping data, maybe it'll help for you, and in this type of setting right here. But no one's goals are smaller than others, and that's what makes it individual. And having a daily shower, being outside and spending 15 minutes out in the day is a wonderful goal that a lot of people can't have or don't have or need the support to do. So I don't know, I guess it kind of rubbed me wrong, and I apologize. Hopefully those little words help.
Yeah, great points, Tricia. I am going to launch a poll right now. All right, so it's our final poll, and then we'll still have a few minutes to talk about questions. And this, I'm just going to go ahead and launch it. And it just says, did you learn something about HCBS and what it means for services and supports for regional center clients? Yes or no? And the second is, are you satisfied with this training on the HCBS final rule? Feel free to answer. Katherine would love to see any other takeaways in the chat that you've taken from tonight. Any other comments, feel free to put in the chat, and then we'll have a few more minutes to talk. And this is not easy stuff. So if you're still wondering what in the world we're talking about, you're not alone. Many of us have gone to many trainings on HCBS, and I think you'll find the same thing with self-determination. Sometimes we have to hear these things many times, and also hear it from different speakers and presented in different ways. So if you're still a little confused, that's okay. It's not black and white stuff, right, Katherine? It's really can be different regional centers have a little bit of a different take on it. Different programs, different settings will have a little bit different interpretations. So it's not going to be a black and white thing. Yeah.
I thought the comments about COVID have been interesting. When this first happened, Sacramento County, everything shut down in March. And, at Alta, we've been working from home since that time. I'm not seeing my friends right now. It's been hard. And I was kind of shaking my head, like my role at the regional center is talking about inclusion in the community and building relationships. And none of us can do that right now. This is crazy. And I think we're feeling the need that we all have for that. When we're feeling the connections we used to have that we don't have anymore, the opportunities we are missing right now, we're seeing the value that had in our lives. But also on the flip side of it, I'm seeing a benefit, and that's seeing more of a focus on the value of individualized supports, where maybe for the sake of, maximizing resources, people would be congregated for the purpose of providing services. Not that it was best for them to be in a group of 6, but because we had one staff and 6 people, and so that's how we made it work. I mean, COVID has kind of put, focus on maybe that is a risk of disease if we're congregating people together, but maybe that will lead to more opportunities for people to be served individually in ways that work for them. There have been new things coming out of this, having some remote services, having alternate services, and the opportunity for creativity is so great because it's being embraced right now. And if we're finding new things that work through COVID, we're going to do our best to hold on to those going forward. So I do anticipate that at some point things will open up again and we'll get back to a semblance that more resembles our, you know, life that it used to be. Yeah. You know, we're going to take this experience with us, and remember that once we can be building these relationships and, you know, involvement in the community, that's something that we want to pursue again, you know, hopefully on a more individualized basis. Very interesting.
Lisa, did you have something you wanted to share?
I said in the chat, one takeaway that I would take from this is to make my IPPs more person-centered.
Good point.
Than they've been in the past.
And what does that mean to you, Lisa? What does it mean to you to be more person-centered? How will that look different?
It means that my goals will have more detail. More detail related to how I want different things to be. For example, if I say I want employment, I'd say I want part-time employment, 4 days a week, maybe 20 or 30 hours a week. I want some benefits of employment like retirement or a 401k plan, things like that. So the goal isn't just written and forgotten about in a couple of months.
Yeah, and you can always contact your service coordinator. Just because the IPP is an annual document doesn't mean you can't make changes to it, revisit it, talk about it further, change a goal. That's okay to do. And with COVID, things are changing for a lot of people. They may be changing their mind about certain things and changing the direction of some of the things that they're working on. So.
Yeah, so maybe some of the rest of you have thought as well through our time tonight, things that you might like to see change, things that you might like to see improve or be better or be different in some way. So any of those changes are, okay, I'm not able to advance my slide. I'm so sorry. Any of those changes are change, right? And you know, it's easy to say we want change, but then when it comes time to how do we make the change, it can be overwhelming sometimes. You know, who wants to be the change maker? We don't always know where to start. But it takes all of us, right? And I think we're on a good start. I've seen a lot of great changes with our service providers over the past 3 years that I've been in this role. I've seen a lot of change, and I'm seeing new vendorizations being developed that are a lot more individualized in their approach, and I'm seeing a lot of creativity. So I'm encouraged on my end, and I want to be encouraging you as well, that you have a powerful role, you have a powerful voice, and you know, when you are with your team, hopefully you have a little bit more direction and freedom to talk about, you know, these are some of the things I'd like to consider and discuss and dream about and take steps towards. So that's pretty much it with my presentation for tonight. I have a final slide that's got my email address I was going to post for you, and I can't get there right now for some reason, but maybe Cindy can share it in the chat box one more time. And I'm available for a couple more minutes if there's any final comments people have, but I just want to thank you for being here tonight and being a part of our conversation. I hope it's been valuable to you, and I'll see you next time.
Thank you so much. Katherine, could you please can you try to take your PowerPoint down? Is that possible?
I'm trying. Oh, there's
there
my slide.
There's
okay.
your slide. Okay. Good. Great job. So yeah, there is Katherine. It's kweston@altaregional.org. I will share out the PowerPoint. And does anyone have any final questions or comments?
Yes.
Great, go ahead.
Yeah. I want to piggyback on a question that I heard someone type in the chat, and that is, how is this all going to be funded? And my answer, if you don't mind me answering it, it's simple. Managed care organizations, like even those that contract with our Medicaid program, are going to have to be taxed because the general fund can no longer afford Medi-Cal or our DD services, our developmental disability services system, period. And I'll leave it at that. And second, as far as what my goals are, I just don't want average services. I want to be able to be a traveler and engage in going on vacations, perhaps being an extreme sportsman in terms of doing winter sports in the winter and water sports in the summer, and going on cruises and everything in between, and owning my own business.
Thanks for sharing, Rick. I think many of us would like to join you on some of those adventures.
Absolutely. That
All
does
right.
remind me of one thing I hadn't shared with you guys yet. And that is, while CMS is saying, okay, these are the conditions to meet if you want to continue receiving funding after 2023, these are the changes, you know, we expect you to make if you're not there yet. California has recognized our providers might need some assistance and has made some funding available through the state budget. Each year, they've added $15 million or set that aside towards HCBS compliance projects. So those have been funds that providers can apply for, and then DDS selects a certain number of projects to fund. So if you are a provider or know a provider who would be interested in applying for funding, the next year of funding should be posted to the DDS website very shortly, probably any day now. And if you're not sure about the link for that, you can email me and I'll send you the link. But that's a great way for some of our providers to kind of get through some of the hurdles that they face at the start of this.
Okay, well, it's after 8 o'clock, so we just want to say thank you to all of you for joining us. I will be adding you all to the State Council's statewide email list. And if you would, since I know so many of you are not from Sacramento, I will send out an email. And if you want me to add you to our local list for the Sacramento region, then you can just email me back and say, please add me. I don't want to add you if you're from out of the area and bombard you with Sacramento news. So I will let you opt in by emailing me back. So look for an email from me in the next 48 hours. And we'll include the links that Cindy had put into the chat. So in case you were not able to grab those, and any other information that Cindy or Katherine have to share, please, we will include that in one email to you. So again, thank you so much for joining us. Everyone be safe and have a great evening.
Thank
And
you, everybody.
Stella.
Thank you.
Sonia.
Thank you, Stella, for
Thank you.
interpreting.
It was fun. Woo!
Thanks, Rick. We're going to go on a cruise with you. Bye-bye.
One of these
Good night,
fine
everybody.
Bye.